In this next film, we will be showing you how to use the glucometer with a patient.
Hi, my name is Dr. Emi Mbale and I'm going to take you through doing a glucose check on a baby.
You will be doing glucose checks very frequently. There are many different reasons why a baby might need one.
They might have hypoglycemia because they have symptoms, they may be jittery, they may be having seizures, or just in terms of monitoring, you're putting a preterm infant or a baby of a diabetic mother and you want to make sure the glucoses are well maintained.
Also remember that all preterm babies need to have a blood glucose test on admission to the unit soon after birth.
So we decided the baby does need a glucose check. I want to make sure that all our equipment is also readily available. Here we have our gloves for infection prevention.
Apart from gloves, you need a lancet to prick the baby and a sharps box to dispose of the lancet.
You need a disposal, a bin where you're going to throw either your swabs or the strip that you're going to get from the glucometer. Okay, and here we have the actual glucometer. So you have the glucometer itself here, the strips, and the test fluid. Okay.
And finally, an alcohol swab to clean the area where you will draw blood, and some dry cotton or gauze.
So you've decided your child needs this and you've got all your equipment ready. You want to talk to mom and make sure she understands what you're doing and also why you're doing it so that so that she can cooperate and support you within the process.
Next, you need to clean hands, which should be done between each patient.
So first things first, infection prevention. You need to protect yourself. You need to also make sure that you're protecting your patient. So you go and wash your hands or sanitize and then put on your gloves. Now, it's very important to know the right location as to where you can actually do the glucose test in a neonate, because if you prick them on the wrong place, you can cause more pain, it can cause more complications.
The prick with the lancet should be done on the sides of the heel. Either foot is good. But you must not go into the back of the heel, or fingers or toes. Otherwise, you can cause serious wounds and even gangrene.
Do you want to do the prick within this area and that area, or that area and that area? You do not go into the heel or into the toes, because you're going to cause damage to the baby's bones and the baby's nerves and vasculature.
Now you can put the strip into the machine.
So the side that has the little dots on that end is where the blood goes through, and the one with the more solid gold plate there, that goes straight into the machine.
The glucose strip should click into place. With this model, notice the machine turns itself on as soon as you insert the test strip. You should see the image of the test strip and drop of blood. Clean the area well and make sure the alcohol dries before you prick the baby, otherwise it can affect the reading.
So you put that in. So we're using a lancet.
Then take out the lancet and prick in the area that you prepared.
All right.
Then immediately throw the lancet away in the sharps box.
You'd want to wipe off the first drop, because you don't want to use that for checking the glucose.
You use dry gauze or cotton to wipe off the first drop. You must not use alcohol, as this may affect the reading. Then you use the second drop of blood for your reading. You just need to touch the blood drop with the end of the test strip. Keep the glucometer horizontal. The reading comes in 6 seconds. As soon as you have your sample, you need to quickly put a swab on the baby's heel to stop the bleeding. You can ask the mother to hold it while you finish up. This reading shows a healthy blood glucose level.
After you've got your glucose, you've got your result, then you obviously need to tell mom, your baby's glucose is okay or it's abnormal, and whatever intervention you're going to decide to do. Okay?
Remember, the reading should be above 2.5 millimoles per liter or 45 milligrams per deciliter. If the reading is below that, but above 1.2 millimoles per liter, then what you do depends on the baby's condition. If the baby is alert, can breastfeed, or can be fed by a cup and a spoon, or has a nasogastric tube, then Give the baby extra feed and check again 30 minutes later. If, on the other hand, the baby is unable to feed, you should immediately administer 2 milliliters per kilo of 10% dextrose intravenously and start an infusion of 10% dextrose. For any baby whose blood glucose drops below 1.2 millimoles per liter, you need to give the same treatment. 2 milliliters per kilo of 10% dextrose and start an infusion of 10%. Some national guidelines may differ slightly from the blood glucose levels shown here, so you should also check these. Whenever you find and treat low blood glucose, you need to recheck the glucose levels 30 minutes later.